I think it's true when they say doing certain things can buy a country time. So for example, we've been on our 6th or 7th week of um, enhanced community quarantine or lockdown, as other people may call it. And that's probably the reason why I can be here to talk to all of you now. Um, Perhaps what I'd like to share is that for a systems person like me, I am not an epidemiologist. I don't do infectious disease work. I don't do pandemic work before this. Um, I do long-term health sector planning work for universal health coverage. In the beginning, I was a bit overwhelmed because everyone had to pitch in to do this, right? Um, but then after a while, for me, the entire response actually provides for a silver lining to the longer term health system investments that I have been working for in my entire career in the health sector. In the beginning, I thought, wow, everything stops for UHC because now people have to channel all their resources to fighting this pandemic. But what silver lining am I talking about? So first, little things like telemedicine. In the past, we have given so many excuses to say it can't work. Filipinos want to see their providers, talk to them, touch them, etc. We cannot do telemedicine. We shouldn't reimburse these kinds of services. But because of the nature of coronavirus, we had to start doing it because you have to lessen the people who go to your health facilities, less so in hospitals, where in the Philippines, usually patients go directly to the hospitals because we have a weak primary care system. So that's one. Second was about investments in new facilities. And in the past, it took us a long time to build primary care facilities or infirmaries, for example, where people can stay 1 or 2 nights. I think it's urgent care centers for other countries. And because of what happened and the need to isolate, why do I say the need to isolate? Because I would say in other countries, they did home isolation. But in places where socially, Filipinos live in smaller homes, and also privacy within the family homes is not such a big thing, meaning people live in close quarters, etc. That's not good for coronavirus. And that's why the government has programs to rapidly scale up isolation capacity, meaning temporary housing for people, especially in low-income households. So we have built several isolation facilities only in a few weeks' time. That before, it took us, what, years to build them. So they all add up to the stock of facilities that we may actually be used in the future. Third would be probably a renewed appreciation of people for a vaccine. Everyone knows that vaccine confidence plunged in the Philippines when we had issues around rollout of anti-dengue vaccine. But now everyone's like, okay, when is it coming out? When we need it, blah, blah, blah. And actually now is the time you tell people that, oh, we can't just roll out any vaccine because they have to go through certain safety procedures. And finally, as head of health promotion in the country, this is actually the best time to push for intersectorial policies that make it easy for people to live a healthy life. So for example, because of the new normal policies that we need to implement, everyone looks to the health sector to say, okay, what are the minimum standards that we need to put in place? In fact, part of the new normal is building, making sure that the active transport mechanism happens, triggering people to bike, widening of pedestrian or sidewalks, which have for the longest time been in the back burner for social policies. Yeah, I would say that those are the things that make it very interesting for me to actually watch the response at the front lines, because apparently it wasn't so much a trade-off between what I was doing and what I wanted or what I aspired for my country in terms of long-term health system development. It didn't really have to be a trade-off, but actually, it actually accelerates a lot of the things that we had long wanted to do.